Well, there are certain things that happen once a year that we don't always look forward to. Taxes certainly come to mind, but something that can be equally confusing is open enrollment, especially if you're signing up for Medicare. We need to know there is help out there. So we have Mike Kateri with us, an insurance agent with HealthMarkets. Sorry, this happens when you're pregnant and your baby's sitting on your lungs. It is a nationwide leader in independent health insurance. So I want to welcome you, Mike, to Daytime.
Thanks for having me.
All right. Well, we know you have a lot of experience, 14 years in the industry. So tell us the basics of signing up for Medicare.
Well, open enrollment starts on October 15th, goes through December 7th. But starting tomorrow, Medicare eligible individuals have the option to look at plans. And so what they should be looking for are new plans for the new year, making sure that their doctors are in their network, making sure that the prescriptions that they use are part of their formulary, making sure that the way they're going to use their plan, their doctor's office visits and hospitalization plans will be covered the way that they need them to be.
Okay, so you can do it on your own, but it's not easy.
Yes.
So how can you help make it easier for folks?
Well, what we do is we sift through all of the various carriers, all of the various options. We have software programs where I can punch in the way someone uses their plan, and it will show me which will be the cheapest plan and most affordable plan for customers for the new year.
Okay, so is it a good idea for every year people to sit down and kind of review their benefits, look over what they had last year, what they're going for this year?
Most definitely. I would strongly encourage everyone to review plans every single year. If nothing else, there are always new carriers entering the market. Current carriers change the list of doctors and hospitals that are in their network. And so even if you've been 100% happy with your plan, you may want to review to make sure that it's still going to continue to meet your needs for the new year.
And sometimes if you sit down and look at these things as somebody who may not know a lot about it, you may not know what things you need to change. So I imagine coming to somebody like you, having kind of a face-to-face interaction is really the best way to do that.
Absolutely. We always do everything face-to-face. It's an incredibly cumbersome process. One of the things that we always want people to understand is there's never a charge for our services. And we want to make it, simple. So we take all of the confusing terminology in the industry and try to make it simple for somebody.
And let's talk about some of those things. What are some of the kind of facets of Medicare that people may not know about or realize that they need to look into?
Well, a couple things. One are the dates. Many people don't realize that if they send in their application early, that it will actually be declined by Medicare. If they wait until after December 7th, that again, it will be declined. So making sure that plans don't get sent in before the 15th or after the December 7th is important. The other is what's called low-income subsidy. Many Medicare-eligible individuals have the ability to get their prescription drugs at a reduced rate and sometimes even have their premiums paid for by Medicare. But when I sit down with Medicare-eligible individuals, usually 50% of the time, if not more, people who are eligible for low-income subsidies don't even realize and have never even applied for it.
And what's that like when you sit down with somebody who kind of comes to the realization that they're not really getting, full advantage of what they can when it comes to Medicare and what it has to offer?
People are very grateful that you're able to help them. I can tell you that in the individuals is certainly my favorite clientele, and you leave a lot of times with hugs and with smiles on your face.
Sure.
So it's a great customer to be able to help.
And let's go through those dates again, because I think that's really important to make sure that people realize that there are strict dates. You've got to hit those dates in order to apply.
Yes. So starting tomorrow, October 1st, is the ability to review plans. So people can start making those phone calls to set up those reviews as of today. The review time goes from October 1st to October 14th. And then as of the 15th, policies can be sent in. So if they date it before the 14th, going to be declined. But the enrollment period, again, is October 15th through December 7th. And again, those are very, very strict dates.
So let's talk about somebody coming in, sitting down with you. How do they go about doing that if they want to start looking at these very soon?
So the first thing they do is they give me a call. We would certainly suggest that people call sooner rather than later, because as we get into that December time period, we get incredibly busy. But give me a call, contact us off of the website, and set up a time for us to come down. Again, it's free of charge. There's never a fee for our services. We'll take about 30 minutes. We'll review the plan that you're currently on. We'll review the options for the new year. If you're better off where you're currently at, we'll certainly tell you that. But if there is a better option for you, we'll help you get enrolled. We'll take care of all of that process and make sure that it's a seamless process.
Now, you also have a best price guarantee. What is that all about?
work with over 180 different carriers. And so as a company, we can guarantee that we will be able to give our customers the best possible rates for any of the plans that we recommend, or that we represent, I should say. So whether they go directly through the carrier or whether they go through one of our competitors, we guarantee that our price will be the lowest of anyone that's out there.
Okay, that sounds perfect. We have your information, website, phone number up on screen if somebody wants to get a hold of you. So thanks for bringing that to us today.
No problem. Thanks for having me.